If I look excited, it's because I'm preparing to discuss two things that are very, very important to my heart and should be important to everybody's heart. That's health and volunteerism. So today we're going to talk with Miss Rita McCurdy of Macon Volunteer Clinic and Dr. Keisha Callins, who is a volunteer with Macon Volunteer Clinic. And volunteerism, I want to talk about that first because I think all of us have a responsibility to the extent possible to give back to the community. And, I'm very, very impressed, though I just met her, and encouraged by seeing this young lady who's a medical doctor who thought it would not be robbery to give back to the community and share her experiences and what have you. She's a volunteer with Macon Volunteer Clinic. So thank you.
You're welcome.
Thank you so much, and congratulations on doing what you do. I think it's extremely important. So tell us a little bit about yourself.
Well, I am fairly new to Macon. I've been here just about a year and a half. I'm an OBGYN, and I moved here from Albany, Georgia. I joined the faculty at Mercer School of Medicine last year, and also I'm currently working with Community Healthcare Systems, which is also a community clinic that services Middle Georgia.
Okay.
So I have two young children. My son is 13, my daughter is 9, and I am married, and I have 7 chickens. So.
You don't donate eggs, do you?
We eat them all.
Oh, okay. Okay, and so how happened you decided to volunteer with Macon Volunteer Clinic?
Well, it just so happens that one of the physicians who's been a long time supporter is Dr. Patrick Roche at Mercer University School of Medicine, and he asked if I was interested in helping out and said they could probably use some help, and so I thought, sure, I'll check it out. It's always a good, especially when you're in a new community, to try to figure out what's going on and how to become involved. And it's right here in Macon, and that was easy to do. And one of the things that I like is they don't give you a set expectation. They work with what you have to offer. And so if you can go once a month or once every 2 months or once every 3 months, they're not going to turn you away because you cannot make a bigger commitment. And I think that's something that people get concerned about, is overcommitting themselves, especially physicians. Can I really do more? And, for one afternoon in the month for 2 to 3 hours, that's not terrible. That's like a walk around the park. So not unreasonable. And that was one of the things that was attractive to me.
And the flip side of that is that there are individuals who don't do anything. So I think the point that you're making is that it doesn't have to set the world on fire, but if in fact you're giving back, then that means that it's helping somebody and you're making a measurable and a significant contribution, to a worthwhile effort. This is a call to action.
A call to action.
I'm your host, Alex Abraham, and as I said, we have Mrs. Rita McCurdy, who's the Executive Director of Macon Volunteer Clinic, and Miss Dr. Keisha Callins, who's a volunteer at the clinic and also teaches at Mercer School of Medicine. Welcome to Macon.
Thank you.
Okay, now, so let's talk a little bit about Macon Volunteer Clinic and what is the purpose and things of that nature.
Sure. Well, the clinic was started 15 years ago as a nonprofit, and the idea was that there are so many working adults in Macon-Bibb who are employed but really have no access to health care because they don't have health insurance. So the idea was based on other successful nonprofit clinics around the country that reached out to their community and said, with volunteers like Dr. Callins and others, can we see these folks and provide the health care they need at no cost to them, which benefits obviously the patient plus their employers. They're able to stay employed, benefits our community because they have a source of health care besides the emergency room. So really that's been our model for 15 years, and we've been going strong since then.
Okay, now what kind of ailments can you treat? I mean, I told you about this person that I know who's who does not have insurance, but he's got a dermatological problem. How about my saying that word, doctor? And I'm sure that there are other instances like that where we've got individuals in the community who've got some kind of health problem or health concern, who's employed, but don't have insurance. A lot of companies work you 30 hours, and they don't provide fringe benefits. So just what kind of services do you offer in what areas?
That's a great question. We really run the gamut from primary health care, which would be folks who just have diabetes or high blood pressure or something a little more common, to more specialized care like Dr. R.Callins provides as a OBGYN. And then we also have dermatology volunteers, we have an orthopedic volunteer, we have eye professionals, dental. All those folks come and donate their time as well. So I would really encourage anyone who feels like they're eligible for services, contact us for a screening appointment to see if they're eligible, and if they have a health concern, either we can treat it at the clinic or most likely we can find an avenue for them to have that addressed.
Oh, that's so very, very important. This is a call to action with your host, Alex Haversham, discussing two important subjects today. And in this instance, they are related, healthcare and volunteerism. And healthcare on a daily basis, it's kind of sad, to see so many people walking around with illnesses and problems and who can't go to the doctor or don't go to the doctor because they don't have access to health care. And I don't want to get all political and things of that nature, but I think it's human. And I think it's extremely important that we are subjected to have the opportunity, if you please, to go to a doctor, or if there's something that's wrong with us, to go to somebody and to see about it. I think it's equally as important to know that there's an organization in our community that sees the value and the importance and the significance of providing health care in our community to a group, that otherwise would not receive. I just think it's inhumane. I'm gonna just say it. For a person to have to, to have a problem and, and know that they need help, and we have enough problem with people who know that they need help and don't go. But for a person who knows that he or she needs help and don't go because they can't go, then it really is a problem, and it generates a good feeling on my part when I know that there's an organization, Macon Volunteer Clinic, headed up by Miss Rita McCurdy, who's the executive director, in the community that will treat people who are employed but don't have insurance. Now, talk specifically about some of the ailments that you all have, although you say you run the gamut, because oftentimes when a person hears diabetes, when a person hears some other illness and you say it, then that might spark that person, to give you a call to see if they qualify.
Sure, yes. We see a lot of folks in Macon Bibb, and those are the folks who are eligible for our services. You have to live in Macon Bibb. But we see a lot of folks with diabetes. We see a lot of folks who have high blood pressure. We see a lot of people with high cholesterol who, otherwise have heart problems or asthma or breathing problems. Just lots of different, even common, what you would consider a common ailment. So we encourage those folks to come in and see us because we can provide lab work, we can do x-rays, we can provide MRIs as needed,
Wow.
CTs. We can really provide all that, plus preventive health care like mammography, mammograms, and cancer screenings. So there really isn't much we can do. We also for folks who have diabetes and other conditions like that, we're able to provide them with one-on-one nutrition counseling. We have a volunteer dietitian
Wow.
who meets with them. We have mental health counselors who volunteer as well. So,
Hold right there.
sure.
She said mental health counseling. And I think we need to talk about that. Because I saw a report once that said 75% of the people in the world need mental treatment. You know, and sometimes, you know what's strange, Doc? You know, people will go and try to take care of a physical medical problem. But then when they have a psychological or a mental problem, then they won't address it. So I just wanted to say that, you know, if in fact, you know, it seems that you have some kind of difficulty, that doesn't mean you're crazy. And guess what? That's the reason they got psychiatrists and medical doctors. Otherwise, you know, there's a need for both. So it's just good to know. You know, and I teach in the prison system. And a lot of people are in prison, you know, because they have needed some kind of psychological or mental help, somebody to talk to, and nobody to talk to. So I just want to get on my bandwagon, you know, and talk about it because it's important. So my point is that if you or somebody you know seem to be having some kind of distress or mental problem, then if you do have insurance, use your insurance and go to a doctor. And if you don't and you're working, call Miss Rita McCurdy and call the clinic.
Yes, and I'd like to just add.
Go ahead, please.
You know, you mentioned the availability of preventive health services. For so many people, because they don't have access to health care, they think of only going to the doctor when they have a problem. We want to see you once a year just to do your routine screen, and that's important. The second point is that I think that when we offer medical services regularly to our population and to our community, we begin to realize that there are a lot of medical conditions that come from mental health issues. For example, if I'm counseling, and I specialize in women's health, that's my passion, if I'm trying to get my mom to lose weight, I have to address why she's eating Twinkies at midnight, right? If she's depressed or she's stressed out because she cannot pay her bills or take care of her kids, then that may lead to behaviors over the time that may lead to hypertension or diabetes. And so having a facility that offers preventive health services is very unique and important because it's more than just treating the problem. We're also trying to get ahead of problems. And that's something that a lot of our patients or community don't have access to until they enter the system because they have a problem. So we can get ahead of that. And that's one good thing, one of many good things about the clinic.
I'm glad you said that because I thought about it, but I hadn't said it yet. And I'm glad you said it because I was just wondering whether one have a problem and could they just come for a regular checkup, you know, which everybody should do once a year.
That's right.
Because like they say about different problems that result in death, unfortunately, you know, early detection is the answer. So you're saying that they could just come for a checkup?
Yes, that they can and they should. Yes, come for a checkup for once folks are screened and confirm that they're eligible for our services, then we'll set them up with a volunteer physician and they'll have a complete lab work done. And we occasionally find folks who are diabetic or have high blood pressure and they don't even know it. So we need to go ahead and get on that, get them treated before it progresses. So they might not be seeing symptoms yet. So as Dr. Callins said, we want to go before it snowballs into a bigger problem.
You know what I thought about, Doc and Ms. McCurdy? You very seldom hear that a person died from natural death. Which means that in most instances, when people die, they die from some kind of medicinal problem. You know, and I said that to say that it's pretty obvious that going to the doctor and getting good medical care can prolong your life. Can prolong your life. So I think that's extremely important. What about other forms and kinds of treatment, like eye care and skin care and?
Absolutely, yes. So we have specialists like dermatologists who will come in. We have gynecologists like Dr. Callins who come in as well. We can also refer folks out for GI or gastrointestinal problems. So there's really a lot that we can do. And in-house, you mentioned eye, we have an ophthalmologist in-house who volunteers, so we can check people's eyes. We can prescribe eyeglasses in conjunction with the local Lions Club. We're able to get those for free.
Wow.
We have a dental suite with volunteer dentists who can do fillings or extractions and cleanings as well. So really all of those things, you know, and again, that preventive part of it. And then one of the big pieces that I haven't mentioned yet is that we can also help our patients get free prescription medications, non-narcotic, but prescription medications if they have diabetes or if they have arthritis or they have asthma. We can enable them to get the medications that they need at no cost, because otherwise they're unaffordable really at the pharmacy.
Talk a little bit more before Dr. Callins talk about volunteerism, you know, about what it takes to qualify.
Sure. So
what kind of screening?
That's a great question. We see working adults who are age 18 to 64. And that's because folks who are younger than 18 are normally covered by Children's Medicaid here in Georgia. And then once you turn 65, most people are covered by Medicare. But that group in the middle from 18 to 64, they very often have nothing. So they have to be those ages. They have to reside in Bibb County, and they have to work in some capacity. It can be part-time, it can be full-time. And they cannot have any kind of health insurance. So they can't have Medicaid, they can't have Medicare, or any other, you know, health insurance source. So we provide all their health care for them.
Thank you so much. Dr. Callins, talk a little bit, first of all, what drives you or motivated you to serve as a volunteer? I mean, why are you doing this? You're an OBGYN. You know, you don't have to do this, and, you know, thanks for serving. You know, because, let me say this quickly, please.
Okay.
Yeah, you don't have to be in the armed forces to serve. You know, so I thought about that when I said thanks for serving. You know, because, you know, I hastily, you know, tell individuals, veterans, thanks for serving. But then you can be told thanks for serving too, because there are all kind of volunteer areas and opportunities in the community, as evidenced by what Dr. Keisha Callins is doing. So talk a little bit about, you know, encouraging other people, and also discuss what motivated you.
So the first comment I'll make is the fact that I think anyone that goes into healthcare wants to help make a difference. But sometimes that can be overwhelming because there's so many problems and so many people, and it's easy to get sometimes distracted by how overwhelming all the problems are. However, I've decided to look at it from the perspective, which is what I share with my students when I teach. You may not be able to change the world, but you can change the world for every person that you take care of. And in particular for me, as an OBGYN, my theory is that the women are usually the center of the family. And so if there's anything that I can do to help that mom or the center of that family feel better, mental health-wise, physically, then that's going to impact her whole family. When she does well,
Yep.
her kids will be well taken care of, the husband, the partner, the grandma, people at work, people at church, everybody will benefit. And so in contrast to what you said earlier, I do have to serve, because
You
that's
do have to what?
serve.
Okay.
That's my motivation.
Right.
If we can help our ladies to shine, everybody will benefit. So that's my driving force. In terms of volunteering, there are lots of opportunities at the clinic. We need physicians, we need specialists, we need nurse practitioners, we need physician assistants, we need RNs. I believe we will use LPNs, we will use educators, nutritionists, anyone that can be a part of that healthcare team. We need them on board. And there are enough medical professionals around where if everyone gave 2 hours, we would probably have a waiting list. And so we do want help. We do need help. And it's an opportunity, maybe from your usual clinic setting, to see people in different capacity. And everyone has a right to quality health care. And the physicians and the other volunteers that we have there, they're there because they want to be there. They want to make a difference. And they could be doing other things. But if everyone just carved out just a little bit of time. I mean, most TV shows, or you go to the movie, they're 2.5 hours. Give up a movie. Come volunteer.
Yeah.
That's not difficult to do.
Yeah. It's not difficult at all. And I want to thank you again for serving. Okay, now let's talk a little bit about people. Are there any opportunities? I know we got so many people motivated to come to Macon Volunteer Clinic until it's not funny, you know. So are there any other besides opportunities, besides medical professionals who can come and help? Now, or in any other capacity, they don't. If not physically, you know. Are there any services that the businesses can provide financially? Just because it takes a village.
That's right.
You know, we all have a responsibility. So what are the other areas, you know, other than medical volunteers that you can be assisted?
Really, there are so many different ways that people have helped us and that we continue to need help in. Just even from answering phones and taking messages to on the Monday and Tuesday nights when we have a late night clinic, we have some sweet ladies and some sweet groups that will bring us snacks or cook dinner and bring those for the volunteers because they know that they've worked all day, possibly in a practice all day, and then are coming straight to volunteer. So they'll come and bring that. So really, we are appreciative and in need of lots of different kinds of services. Pretty much anything anybody can do, we could benefit from. Just even something as simple as making sure that our snacks are stocked for our volunteers, to even paper supplies. You know, we go through.
I was going to ask you about that. So if there are some businesses who might have some products and services that you can use,
absolutely,
you know, like printing and things of that nature, then they can call and volunteer.
That's right. Every dollar of those items that is donated, that I don't have to spend on copy paper or toilet paper or, you know, all the supplies you need for a nonprofit and for a clinic, that's a dollar that we can devote to patient care. Wow. So it's an amazing trade-off, and we do have people who come in and drop off items like that regularly, and we can always use more.
Wow. What about community outreach? What about if there are some entities, organizations, or programs in the community who would like at least to know more about what you do? Do you have someone who could go out and talk about MVC, or has that happened before? Because, you know, like with churches and other organizations may want somebody to, you know, because you can as you talk about the services that MVC provides, you know, there can also be some education that's done. And I know Dr. R.Callins is busy, but, you know, we need to just educate it takes a village. You know, I keep saying that. It takes a village, and this is a phenomenal community, you know, and it's people like you who help to make it even better. And just like you can do it, I'm hopeful that other individuals who are listening to us, you know, decide to volunteer. It doesn't have to be with Macon Volunteer Clinic, but you can volunteer at school, you can volunteer at the recreation department, you can volunteer with some kids at the Boys and Girls Club, but that's what helps to build a community, is how the citizens and those of us who are doing okay in the community recognize that we too can play a role in making this a better community. So would you go out and speak? talk to anybody? Or?
Yes, we are happy to do that. We frequently speak at Rotary, at church groups, other functions. We attend health fairs like the Navicent health fair. So we are happy at any time that we have availability to come and speak with a church, speak with a Sunday school group or another group, and just share our successes and share a little bit more about what we do and what our needs are. Would love to do that.
Okay, did you say that you're also in private practice?
I do. Mm-hmm.
Where?
So I work in Jones County and also in Twiggs County.
Okay. What's the name of the practice?
Community Healthcare Systems.
Okay, I know you're not here for a commercial, but I see your reluctance, but this is my show.
Well, I'm actually happy that you asked, because
Yeah.
we're actually a community healthcare clinic that provides healthcare to the community.
Yeah.
We have 14 clinics throughout Middle Georgia, and we service a lot of our rural communities.
Outstanding.
And
Is
so
that with
that's
Crystal?
important.
Crystal Owens?
Yes, Dr. Owens is our medical director.
Yeah,
Yes.
yeah. We go to church together.
Okay.
Yeah, yeah. Okay, is there any other statements you'd like to make before we close out?
Yeah, just, we appreciate the opportunity to come and talk about what we're doing, and we appreciate our community. The reason we've been so successful is because of our volunteers, our partners, just folks who, even though they may not be medically trained, they're still able to provide us, they do what we can, even just providing a free pizza a week. It does take a village.
What's the process for getting in touch with you?
Sure. So the process would be, you can do two things. You can give us a call, and that number is 478-755-1110, or you can go on our website, which is maconvolunteerclinic.org, and there's contact information there as well.
An important statement from you, Doc?
Yes, I would like to mention one other great thing about the Macon Volunteer Clinic. I've had a chance to be a volunteer now for actually almost as long as I've been in Macon. But it's really important to have someone in the community be an advocate for you. And Rita and I have worked on a couple cases where we have patients that have very special needs, and we may not be able to provide all those things for them, but we have to help advocate for them.
Yes.
If that means writing letters or contacting other people in the community for resources. But I have seen it in person, and I've been fortunate to be a part of the team to be able to advocate for patients that if we did not do that, they would be stuck in the crack of the healthcare system.
Yes.
And so we have services, we have volunteers, but we offer advocacy where they may not find that in other places.
Right. And we're going to try to reduce the number of unnatural deaths. And I think that Macon Volunteer Clinic can play a role in that. This is a call to action.
A call to action.
I'm your host, Alex Habersham, having interviewed Miss Rita McCurdy of Macon Volunteer Clinic and Miss Keisha R.Callins, who's a volunteer with the same. Thank you, ladies, so much. Keep up the good work. This is a call to action.
A call to action.
I'm your host, Alex Habersham. Have a great day.